Kevin, Pat.
Ed's in the lower right.
Ed's what?
If you were looking for Ed, he was in the lower right-hand corner
Yep.
on my screen anyways.
All right. Without further ado, let's get her going. I'm assuming you all said the Pledge of Allegiance on your own at home before we started, so we'll dispense with that and we'll move on to approving the minutes. Pat, did you notice anything? You're our minutes hawk.
Now, usually, however, I was busy looking at the needle exchange information and the DRI information, and so I'm a little late in getting to our minutes review. So
I didn't notice anything amiss.
there's nothing that is glaring to me, and our great staff usually keeps any errors to a minor. So I'll make a motion that we accept the minutes.
Second.
Second discussion, all in favor?
Aye.
Unanimous, moving on. Authorization of the payment of the bills.
I'll make a motion that we authorize the payment of the bills.
Second.
Discussion, all in favor?
Aye.
All right, unanimous. Next up, the treasurer report. As always, Tanya is doing a lot of work. We have a motion to accept.
I'll make the motion to accept the treasurer's report. Wow, somebody's gonna leave me hanging. Thanks, guys.
I'll second, sorry.
Thank
Yeah.
you. All right.
Sorry, I was reading.
Discussion, all in favor?
Aye.
Unanimous, moving on. All right. Cemetery report. I don't know if we have, I don't think we have Jim on tonight, but Jim Jr. Pretty busy.
I'll make the motion to accept the cemetery report as written.
I'll second that.
Discussion, all in favor?
Aye.
Unanimous, moving on. Codes. Although we have dog control next, but that's all right. As always, Kevin, very busy.
I know we're still having issues with people parking on their front lawns.
Yep, we're gonna have to address that again. I've noticed it getting worse in certain areas, so we're gonna have to maybe put something out in the next water bill newsletter to remind people that it's okay if it's, you know, you're having a Super Bowl party or some sort of a big event, but as a day-to-day thing, it makes the village look really shabby. So we gotta stop that.
Like you said, it's one thing when they're retarring their driveway. We get
Sure.
that, but it's the other ones. I think we have to look at what the fines are and start sending some of those out, because I know Kevin has been sending warnings to them multiple times. I think we might need to step that up.
I think so too. I think we're gonna have to start fining people, unfortunately.
I'll make a motion that we accept the codes report as written.
Second.
Discussion, all in favor?
Aye.
Unanimous. All right. Dog control. Looks like just two little rapscallions running loose.
Still like the other one better, but I make a motion that we accept the dog report as written.
Discussion, all in favor?
Aye.
Aye, unanimous. All right. Let's see here. Where are we now? We are at
DPW.
DPW. Very busy, folks. Phil, I see we got you online. Anything you want to highlight from your report this month?
As you see, we got all of our paving done for the year. So That's a plus there. We gotta go around and do a little more topsoil and stuff, especially on Phelps Drive on the corners there.
Right.
I had them bring the intersection out straight, so there's no more like little hill in there before you get to 281. So I took a little extra blacktop to do that. But we'll get on and get some topsoil for those people.
While I've got you on here, and I see we do have Dante and Chief Pittman, so it's the three that we need to talk to. And I wish I could tell you. I think I know who. Actually, I know who did approach me about potentially putting in turning lanes at 90 and 11. Just basically, so you're going to go left or right to help separate that. And then also at the end of James and 281, because there is enough room. They're pretty wide intersections. I don't know if we could put a turn lane in to help some of the traffic flow a little better or not, but I don't know what your thoughts are.
Yeah, I'd have to look into it, probably do some measurements to make sure there is enough room. But
Yeah, and then I think with 90, we'd have to get DOT approval, of course, because that's
definitely it's state road. So.
But James we could do, and I totally understand what he's saying with James, because it really does widen up there, and if you could separate the people that are turning left from those that are turning right, make traffic flow a lot better.
Okay, I'll look into it.
Cool, awesome. All right, anybody have anything else for Phil while we've got him here?
Phil, do we need to put flags on the new stop signs at on Copeland?
Yeah, I planned on doing that. And I also, just so you know, I ordered 4 signs that say stop ahead signs for the
Okay.
stop signs.
Good.
I talked to Bob about that, so I'm supposed to be waiting on a quote for, the guy has not emailed me yet, but I'll get back to him tomorrow on it.
Okay.
That's
And then
good.
we still have the radar sign we're looking to put up just prior to the school, correct?
Yes.
So just Chief, a location for that, maybe you and Phil?
Yeah, we spoke here
Yep.
a
Okay,
couple weeks ago about where to put them. And actually, they're not radar, what they are, just flashing 15-mile-an-hour signs.
Yep.
okay. And then, Phil, I know we talked about this just briefly, but again, to take a look at Burgett Drive about the issues with the paving there.
With the Burgett Drive.
Yeah,
Oh, the one on the corner.
Yep.
Yeah.
All right.
I will get back onto that. Yes.
That's always an issue.
Yeah.
Speaking of flags, when do the flags come down on Main Street, Phil?
I was going to try to get them down this week. I was waiting for your input on that, Kevin. If we could start doing it after Labor Day or something, if that's fine with you. I realize it's gone already, but.
Well, yeah, I just figured you would want to coincide both, at the same time. But whenever you guys can get them down, go ahead.
Okay. Sounds good.
My main intent was to wait till after 9/11. So.
Okay. Absolutely.
We're good to go.
Phil, don't we take the flags on Main Street down after November 11th? Or is that something that's coordinated with the American Legion?
That's with the American Legion. So.
My recommendation is we take the flags down at the same time.
Yeah.
Never,
That'd
yeah.
be fun. Yep.
Okay. Thanks, Phil.
Yep. Thank you.
Might need to get a National Grid AOK on 281 because they were expecting them to come down after Labor Day.
Okay.
Oh,
I'll make a
Yeah.
call. I'm sorry.
okay, thank you.
Thank you, Dan.
All right, anybody have anything else for Phil?
I'll make a motion that we accept the DPW report.
Second.
Discussion, all in favor?
Aye.
Unanimous? All right, keep up, you guys, slackers. All right, fire department. Anything you want to add, Steve?
No, other than I did have a typo. The two fires that we had, I said that they were both in Homer. I got confused because we had 3 fires all back to back. For that month, the 2 fires we had were Colebrook Road in Homer and Eaton Road in Summer Hill.
Right. Very good.
Yeah, Stephen, I just want to tell you, and this is a shout out to the entire fire department. You guys were phenomenal. I know that one weekend, it was like 3 fires in 5 days. And you guys responded professionally. And I just wanted to pass that along to you and your entire department for a job well done.
Yeah, not to mention
Thank
the
you.
never-ending severe weather, tree down stuff that you guys have to deal with.
Yeah.
It's good. I don't know, have you put the new saw to use yet?
No, not yet.
Won't be long, I'm sure. But yeah, you guys do a great job. Really do.
Thank you.
And I know tonight, Summer Hill is in theory going to vote on the fire contract, whether or not they're going to go with us for 1 year, 3 years, or 4 different departments for a lot more money. So we'll see how they vote.
Okay.
All right. Do we have a motion?
I'll make a motion that we accept the fire department report as written.
Second.
Discussion? All in favor?
Right.
Aye.
All right, unanimous, very good. Let's see, police department. Anything you want to highlight, chief?
No, but I need to add a couple things
Yeah,
when you're ready. So
Hit it.
this Friday, it used to be called Cops on Top. It's now being called Go for the Gold. It's law enforcement comes together with Special Olympics to raise money for the athletes. We're going to be participating at the Dunkin' Donuts at 31 Southwest Street. That's the first one. Second one, on Saturday, there's a fundraiser. The Cortland County Child Advocacy Center has a 5K. It's going to be in the village starting at the high school at 10 a.m. They're raising money for the advocacy center. And I thought I put this one in there, but when I looked today, I didn't. The annual fall drug take back, sponsored by the Cortland Area Communities of Care, is September 25th at the town hall, starting at 9 a.m. going till noon.
very good. What time is the going for the gold?
That starts at 6 a.m., goes to 10 a.m.
6 a.m. to 10 a.m. on Friday, this Friday.
Yes.
Very good. Okay. I will put it in my calendar.
All right.
Uh,
One thing I wanted to mention, it just came in yesterday. There's no through traffic on Hudson Street between Northwest and Clinton Street. We've got parents taking the sign literally going down Hudson Street, dropping their kids off and turning around, going back up to 281. They're giving the crossing guard. I mean, that corner, you got traffic coming up from behind you. Creates a little bit of a distraction, and she's distracted away from the kids, what her job is. And they've called her a few choice words when she's mentioned to them that there's no through traffic, because their comment is they're not going all the way through.
oh, geez. Come on, folks.
So the law clearly states in there that through traffic is prohibited on the following streets or parts thereof. So the parts thereof, even if they're going halfway down, it's still a violation of the local law. So, it's their interpretation, no through traffic, but it's something maybe need to take a look at to make it more clear, I guess. I mean, what's your thoughts?
My thought is it's pretty clear, and I would just stick an officer there and start writing some tickets.
Well, that's what I did today. I had an officer go over with a copy of the law. As they come down, just hand out a copy of the law and show them there any parts thereof. You don't have to get down the entire street. So,
Yeah, are they writing down plates? It would just be good to know the people that have been warned, and then if they're,
Yeah, that's what the SRO was doing over at the the elementary school. Same thing, no through traffic. He was writing them down, giving them a warning.
right,
And then if they did it again, he was writing them tickets.
yeah, that's what we should do.
Yeah.
It's been pretty clear for a while. That crossing guard does not need to be distracted.
No, and I told,
And certainly not bad mouth either. That's out of bounds.
they're calling her some names that I can't even mention.
It's not
Absurd.
okay.
Absurd.
Okay.
So, and I've told her her main job is those kids. Don't get
Right.
distracted with the parents that are parking, everywhere and anywhere, because first day they were blocking the entrances to that side parking lot. And
I know.
her main job is the kids, get those kids across. So,
Yep.
so
Yeah, it's like Mad Max with the parents dropping off all the kids, cars everywhere, parking everywhere.
yeah.
Yeah, put the hammer down on them.
Yep.
All right. Well, I wanted to mention it, it's Dante, you're on here. So, that's, it's a local law. If we write them on, you'll be prosecuting her, correct?
That is correct.
So are you good with it? Parts of the streets?
Yeah, the portion that we modified was just to add and subtract streets. The actual, body of the law and the paragraphs are just, they're from the 1980s code that we originated with. But yeah, I'm very comfortable with the language.
Okay, very good. That's all I have. And you,
Thank you, Chief. Anybody else have anything?
Chief, I want to thank Chief for an outstanding 9/11 ceremony on Saturday. I know
Tremendous.
he was the driving force behind it, and both him and his department and Chief Hayes and the fire department and everybody that was involved. It was a truly a well done ceremony, and I want to say I appreciate that. Thank you.
Yeah, it was fantastic.
oh, thank you. It was an honor to put that together. So,
I'll make a motion to approve the report as written.
Second.
I'll second that.
Discussion? All in favor?
Aye.
Right, unanimous.
Aye.
Right. Let's see here. Recreation. I don't think we have Zach. He's probably observing a practice. Let's see. We're still a go. We're still being careful. We did have a COVID exposure during one of our leagues, so we're going to ask to make sure that parents and their kids follow all the protocols that Zach has in place, keep everyone safe. We have a motion on the rec report.
I'll make a motion.
Second.
Seconds. All right, discussion. All in favor?
Aye.
Aye.
Unanimous. All right, that brings us to Buzz. Buzz, I guess we got some big doings this Saturday.
Yep. Want to reach out to people that on Cuga Street from Maine to Fulton. That will be off. Hopefully, we'll like to shut them off at 8 and get started. We're going to start at about 6:30 to get things exposed down there. So Fulton Street from Cuga Street to James and South Fulton will be off. Cortlandt Street from Cuga Street to James will be off, and that short section of Fulton to Cortlandt and James will be off. We handed out flyers. It's going to be on the radio. So hopefully we covered all the bases, but there's never a good time to shut water off.
No, never. There is never a good time. What do those residents need to be aware of when the water comes back on? Is it likely to be a little cloudy, or they need to run it for a little while, that sort of thing?
Well, I've run a little while. It might be a little cloudy. Sometimes it stirs up a little rust, especially, in steel pipes, feeding houses and things like that will kick up a little rust. So we do a good job, try to do a good job of flushing that out before
Right.
we, shut it off to the totally on the main for the pressure. So
Yeah. but even the pipes in the house can dislodge a little rust. So
Yep.
people might need to take apart your faucets or your showers and just kind of clean that out if you start having a flow problem after that, but it's normal.
Yep.
Anything else that you want to highlight, Buzz?
That's pretty much it. Like I say, we're still searching around for more leaks. We're looking at that, why we couldn't get that shut off without shutting Cuga Street off. And we found there's a line someplace on South Fulton Street that has never been shut off, apparently. So, and that's still looking like a needle in a haystack trying to find that line that's in there. So,
Someday you'll discover it.
Yeah. Well, the idea we'll have to discover it, because if it starts to leak,
Right.
unless it comes up, it's it's a loss of water that you may not be able to find. So
Right.
So.
Very good. Anybody have anything for Buzz?
Good luck.
Thanks.
I'll make a motion that we accept the water and sewer report.
Second.
All in favor?
Aye.
Aye.
Unanimous. Okay, very good. Thank you, Buzz.
Thank you.
All right. You're
So
now,
Zach just came online. Do we tell him that we signed him up for everything?
yeah, we did.
Not cool, not cool.
How's everything going, Zach? We did approve your report already, but maybe you can just let us know if there's anything else you want us to know.
Sure. I'm
Zach,
little view
Zach,
here.
can you mention the refunds? I couldn't get my thing to unmute to tell them.
Sure. I've got two refunds. I've got a cheerleading refund for an individual who broke her arm preseason.
Oh,
Then oh crap, I can't remember what the other one was. It was either flag football. Yeah, flag football also broke an arm preseason. So $40 and I think 35 for the other one.
All right. We have a motion.
I'll make a
to
motion
approve
that
those.
we authorize the refunds of the flag football and the cheerleading due to physical injury.
Second.
All right. All in favor?
Aye.
All right. Unanimous. Very good. Anything else, Zach?
Nope. If it hasn't been mentioned yet already, we have one kid in kindergarten who tested positive for COVID. So I sent out an email to the parents to let them know we are canceling practice for this week only. And there's a little bit of a gray area. We don't know when he became symptomatic. If we knew, then we could definitively say whether or not we have to cancel practice. So just out of an abundance of caution, until we hear otherwise, we're just going to cancel for this week.
Very good. Very good. Thank you, Zach. I'll let you get
Thank you,
back
guys.
to it. All right, moving on, we've got privilege of the floor. Anybody here that would like to speak that's not going to speak on one of the items on the agenda? Going once, going twice, going thrice, moving on. New business, Blue Pantry Pod pop-up presentation.
Actually, the old business, needle exchange. moved
Oh,
up
I'm
to
sorry, old business. Oh,
Yep.
we're gonna do needle exchange under old business?
Yes, if we don't mind.
Yep, let's do that then. Okay, so a couple meetings ago, we had an exciting time with some needle exchange discussion. We punted so that the board could collect more information, hear from more people, and also so that we could let the people who were in favor of the needle exchange come back to us with some statistics and data, because really this should be a decision that's based on facts and data and not on emotion and fear. So I know that the board has gotten a lot of information. Chief Pittman did he did an outreach to law enforcement agencies and got their feedback. The office staff did an entire research paper on it. We got something from Cortland Area Communities That Care, and I sent a few things. And I guess I would open it up to the board to voice any of their concerns, and then we can let some of the people that are here to speak on the issue speak. So does the board have anything that you guys want to say ahead of this?
I thought Chief Pittman did a great job getting the enforcement people to talk about the issues on that. And I did read all the material that was sent to me. Most of it was pretty generic kind of stuff. But anyhow, thank you for all the people who submitted and are very passionate about this. Over.
Anyone else? All right. So the first thing I'm going to do is read John Barry, the executive director of the Southern Tier AIDS program, who would administer this. I wasn't able to join us, but he did send a document. And so I'm going to read this. This is just reading his words. All right. Good evening. My name is John Barry. I'm the executive director of the Southern Tier AIDS program. Syringe exchange was legalized in New York State 29 years ago. It's not a new idea. If it was not proving to be a worthwhile service, it would not still be in existence. Its importance has increased as the drug supply has become deadlier and the rate of overdoses has increased. It is highly regulated and monitored by the New York State Department of Health. We operate our syringe exchanges in accordance with all of New York State's regulations and guidance. As a matter of fact, our last monitoring visit from the state found no deficiencies that needed to be corrected. Every service we deliver is legal and in line with state regulations. Let me share the Federal Center for Disease Control's opinion on syringe exchange. Number one, syringe exchange programs lead to a 50% reduction in HIV and HCV incidence when combined with medications that treat opioid dependence, also known as medication-assisted treatment. HCV and HIV transmission is reduced by over 2/3. SSPs serve as a bridge to other health services, including HCV and HIV testing and treatment and medication-assisted treatment for opioid use disorder. Number two, the majority of syringe exchange programs offer referrals to medication-assisted treatment, and new users of the exchange programs are 5 times more likely to enter drug treatment and 3 times more likely to stop using drugs than those who don't use the programs. Number three, in 2015, the CDC's National HIV Behavioral Surveillance System found that the more syringes SSP distributed per the number of people who inject drugs in a geographic region, the more likely the people who inject drugs in that region were to dispose of the syringes safely. The last definitive report on the effectiveness of syringe exchange by the state was written in 2014 because the science around this issue is settled. The intervention saves lives and taxpayer dollars, full stop. There have been some amusing anecdotes and incorrect theories shared recently on how our programs operate and concerning approaches to substance use. If you will bear with me for a moment, I can correct just a few of these numerous inaccuracies. The chief of police of Cortland stated that new syringe exchange participants can receive thousands of syringes. That is incorrect. New program participants are given a maximum of 20 syringes. Number two, the ID cards cannot be traced back to specific individuals. That's also false. The alphanumeric code used for the card consists of first letter of last name, first letter of first name, first letter of mother's maiden name, first letter of mother's first name, year of birth, and day of month. Number three, treatment for all is the answer. Treatment works for many, and we are regularly getting people into treatment, but 80% of our syringe exchange participants have already been through treatment, sometimes multiple times. Having said that, we believe in recovery and have hired many former syringe exchange program participants as staff members. Number four, jail is a good way to get people clean and sober so they can begin recovery. Jail is a great way to make people unemployable and eligible for student loans, and the research shows that upon release, they are at an elevated risk of overdosing because their drug tolerance has decreased in jail. Number five, we do not like the police. A police presence at syringe exchanges reduces the number of people willing to access the program and thus undermines program effectiveness. Number six, HIV and Hep C are not problems in Cortland County. In 2012, Southern Tier AIDS programs tested 100 injection drug users in Cortland. At that point, 34 of them were Hep C positive. Hep C kills more people annually than AIDS and has since 2011. There have been rural HIV outbreaks due to injection drug use in Massachusetts, Indiana, and West Virginia recently. Syringe exchanges also prevent heart infections, sepsis, abscesses, and the like. I wait to hear from the public health director if these are concerns in your county. Law enforcement is not qualified to judge the public health priorities locally. Number 7, the syringe litter in the community is a result of Southern Tier AIDS program distributing syringes. False. It is legal to purchase syringes at most local pharmacies. Fewer syringes might be discarded if individuals were not charged with syringe possession and if a site that wasn't on camera was available to allow for disposal. Finally, final paragraph, judging syringe service programs on the basis of law enforcement input is as ridiculous as asking my advice on how your local police department should be operated. You wouldn't do it and you shouldn't. Law enforcement has run out of ideas for how to address this issue of substance use in your community. And instead of creating new strategies, the only thing they appear able to do is throw stones and try and block new interventions. They are asking you to trust what has already failed us will somehow magically succeed in the future. I believe that your community is smarter than that. So that is his statement. And I do see that Assemblymember Kellis has her hand raised, so we will give her the floor now to speak on this.
Hal, excuse me, Hal, can I just make a comment before we hand this over to? I want to make sure that everybody here knows that Chief Pittman, our chief of police, has been very open and supportive of all different ideas. So what was stated here, I want to be perfectly clear, has absolutely nothing to do with our chief.
Right. It was referring to Chief Sandy from City of Cortland and the district attorney. So, okay. Assembly member, go ahead.
Wonderful. Thank you so much for letting me be here. And I apologize. I'm in the middle of a massive hotel for a conference, so it's a little bit noisy. I'm here really as a citizen and also to support your deliberation on this. As many of you know, my PhD is in public health, so I'm coming from the scientific perspective as well. Of course, you read John Barry's email before I spoke. He touched on many of my points. I do have the CDC reports that do outline the data. I do want to reemphasize specifically that we have found through the science consistently that needle exchange programs significantly increases the number of people who seek treatment. So I think that is really important because we don't have great effective mechanisms for getting people into treatment, and this provides a vehicle for that. What we have also found in Tompkins County, I can say, because we do have that needle exchange program, is that, we have seen a significant number of people who are entering into treatment, but we are also seeing 104% return rate of the needles, because one of the concerns was that we would see needles all over the place. And of course, 104%, you're wondering, where does that, how does that happen? And that is because people are bringing needles back that they're bringing into the community, also that they are finding where they live, sometimes in the homeless encampment. And so they're finding needles there and they're bringing them in. And that is because there's trust that has been built. And so there is a desire and a sense of dignity that they want to keep their own environment safe. So, you can have an emotional reaction, plus or minus, whatever, but the data is what is really important to me. The fact that they are actually getting 104% back from what they distribute. It was super critical. The reduction in overdose you heard, but the reduction of the transmission of HIV and Hep C really can't be understated. And I would suggest if there is still any, consideration or concern, I'm very happy to hear that your law enforcement is open to all solutions. I would encourage, if there's just any follow-up questions, to reach out to the law enforcement in counties that and municipalities that do have needle exchange programs. I've spoken to the county sheriff in Tompkins, as well as our city sheriff, and they have experienced very positive interactions and collaboration with the needle exchange program and also the treatment facilities, the harm reduction treatment facilities that we have. And it might give you some great insights if you're still wondering. And I just wanted to make sure that you knew that was a resource. So I'm happy to share that the CDC information as well. That it comes from, the National HIV Behavioral Surveillance System data, which is a very well-respected national data set. The other thing that I would note is that in these facilities, they also train people on how to use naloxone and distribute naloxone. That reduces the overdose deaths and builds trust. And one thing that I always say is that you can't treat someone if they're dead. So if it's just a really black and white situation. So the only thing I would say on an emotional perspective from what we've seen is that we know from the research that to help someone get off of a substance use, including alcohol, it can take up to 7 attempts for someone to get themselves into a healthier lifestyle where they aren't dependent on substances. And again, that's including alcohol. So to create a system that acknowledges that it's not a once, it doesn't take just once. I think that it's really important that we create an infrastructure that acknowledges the actual reality. And if we don't provide those systems, basically we're saying we've given up on you. And for anyone who's here who's been really, really stressed out, one of the greatest downward spiral causes is when the people who are around you say, your problems are your problems, take care of them yourself, and you're not our responsibility. And by not providing these safe injection facilities, we're essentially saying that, given that the science shows how helpful they are. So I just wanted to share that perspective and offer any support or service, and really honestly thank you all for having the courage to take on the subject, because it's a hard one. It challenges a lot of our instincts, our knee-jerk responses. Our instinct is to think that it would create less safe environment, but the data just doesn't support that. So thank you for giving me just this little bit of time, and I'm happy to be here as a scientist and as a resource and to share my appreciation for you all.
Thank you so much, Assemblymember, for being here. Any questions for her?
Well, I have a question.
Yes.
How has the Cortlandville needle exchange program been going? It seems like it's been going on for years. How's that been working?
I think Dean is on this call, and he has the data on that program. Dean, are you here? Dean O'Gorman?
He is.
Is it all right, Hal, if I...
Yeah, of course. Dean, you're muted.
Here we go. Am I there?
There you go.
All right. Thank you, Anna. To answer that question, Cortlandville has approved it. Okay. And they have not given a site meet on Thursday. But the program is the same exact program that's running in Ithaca and has the 104, 106% return rate up through Binghamton. So as far as it's running, I mean, it's been an established program. And if we can utilize it correctly and get the support that's needed, then we have a chance to have it run at 100% and do exactly what it's doing in Ithaca.
How long has it been running? How many years?
Let's see. I believe John may have addressed that in his letter, but STRAP has been around for well into the 20 years or more. I mean,
STAP has been around for, I think, 24 years.
Thank you, Anna.
So what you're saying is that Cortlandville has had a needle exchange for 20 years.
No, I'm sorry. I'm talking about STAP as a whole.
The health staff.
STAP is the Southern
John,
Tier AIDS program.
So we are the only county, I'm sorry, I want to step in here. I'm Lisa Herschel. I'm the Executive Director of Family and Children's Counseling Services. We provide the local services here in terms of addictions and mental health. We would have a STAP, Southern Tier AIDS project, come in. We are one of the only counties in our region that do not have a needle exchange program right now. So that means that there is no opportunity for our people to find a safe and reliable place to exchange needles, which is why we're seeing Courthouse Park in Cortland. I live up on SUNY Cortland's campus. We see them all over the SUNY Cortland campus. We see them on Main Street. I would not be surprised if you see them in the Green and Homer, because there's no safe place for our people to reliably exchange their needles. And as a result, oftentimes people who are addicted to opiates, especially if they're injecting, and I'll leave it to the epidemiologists like Anna and also to the CACTC folks to talk about this, but oftentimes they do tend to use these opiates in a public setting in case they overdose so that they can be found and potentially saved. And that is what also contributes to the fact that there are oftentimes needles being left behind. So this is a way of a very, very straightforward way of helping folks who may, as Anna said, have gone through 4 or 5 or 6 attempts at rehab, actually access services. We also have 4 medical units that we drive around Cortland, Madison, and Herkimer counties, where we provide outreach, we provide treatment, we provide testing and other outreach services for folks who may be addicted. And I think it's important to remember that most folks, we think of it as a problem of the street, of the alley. It's not anymore. These may be kids who had started using opiates because they had their wisdom teeth pulled, or they had an injury when they were engaging in school sports. And then, policies change and make it much more challenging for them to access the legal narcotics, the legal opiates that they were accessing earlier, and have turned to the street because it's a way for them to continue their addiction without any opportunity for support. So with our mobile units, we are committed to making sure that anytime there's a syringe exchange program in Cortland, Madison, or Herkimer counties, we will have our CODI team, we will have our outreach team there available to make sure we are providing Narcan, to make sure we're providing resources, to make sure we're providing information, and trying to get these people into treatment. If we're not there when they're using, we don't know when they need treatment. And if we wait for them to ask, oftentimes that doesn't occur. So in our view, it's a real win-win situation. On top of that, we provide primary care to all of our clients who need it. And we are seeing a very, very significant increase in the numbers of people who are exhibiting HIV, Hep C, and other issues, health-related issues around opioid use. And we could have the opportunity to save the county significant amounts of Medicaid dollars by addressing those concerns in our clinic. So not only is this a compassionate opportunity, an opportunity to create compassion and support for our people, it's a way of having a positive economic impact. And certainly we all want to see fewer needles in the environment. So, for me, this is a triple win. We will make sure that our CODI vehicles are out there anytime there's a syringe exchange program. Anytime there's any opportunity for syringe exchange, we will be there to provide supports. And we're even talking to Family Health Network about the potential, or at least our primary care physician, about the potential of having our PCP there as well, so that we can try and provide those opportunities for supports, those opportunities to get people into treatment, those opportunities to get people their lives back. It's not their fault they are where they are. Let's get them where they need to be by providing the compassionate support that we can provide them. It's a win-win.
So I just want to clarify also, adding to what Lisa said, Ed, to answer your question directly, Cortlandville has not been up and running for years. Specifically, that needle exchange program has not started yet. It was approved, but because of the budget, they have not been able to finalize a location. And I understand that they're meeting about that on Thursday. So just to clarify, the program that we're talking about is not in Cortland. So I just wanted to make sure from the question that you asked.
Well, the reason I asked is because it seemed from what I was hearing, wrongly obviously, that Cortlandville had been doing it for a long time and they were just re-upping their acceptance. And so basically there's no place in the whole county that's doing needle exchange except soon someplace in Portlandville and the possibility of Homer.
I think,
believe
Ed,
that's
too,
correct
is,
now.
I think what you might be thinking of is Southern Tier AIDS programs.
No.
Very long history of providing this service in other communities. And again, we are the only county, I believe, in an 8-county radius that is not providing this needle exchange opportunity. So that means that, you know, to think that people would be coming to Cortland County with the transportation issues that our people are dealing with in order to exchange needles is just not a reality. They're already able to do that in their home communities. What we have been doing is denying our residents access to clean needles, but also to access to services, to supports, to information on how they can access treatment. And I think that's what we really want to focus on. So Ed, I think it's the Southern Tier AIDS program, which is a very nationally respected organization in Binghamton, who has a very long history of doing this work.
I'm not asking about that, actually. I think they do a great job.
Yeah, they do.
Is there a reason why the county decided they can't, because county's got a lot of land, why hasn't the county done this? And why are you making villages and towns do this when the county seems to have a lot of power and money? Why don't you do it?
Ed, we're hoping to do it in many places, but with transportation issues, as you can imagine, it's really challenging. We need to go to where the people are, not get them to come into Cortland. So, you know, we have homeless camps in Willett, behind the Walmart, under the bridge. We want to go to all of those places, but there are needs in Homer as well, and Cortlandville as well. Let us get to those folks in a way that supports them. I'm not saying we're going to, you know, expect staff to be there once a week or once a month, but we really do feel like we need to be able to address this issue where people live, offer them opportunities for supports and information on treatment, and then we can transport them into our clinic as needed, or we can take our clinic out to them. The idea really is, at this point, find people where they are, provide them supports in a way that's compassionate and supportive, get them into treatment, get them back on their feet.
All right, so
Yeah, Ed, I hear what
you
you're
just
saying.
told me is the county is incapable of finding any county land to do this, and you're actually leaving it up to the villages and towns in the county to provide the support that the county can't with their $50 million budget.
Well,
We may do it, but I'm still amazed.
Let me say that since 2012, they've been trying to get the county to move on this. Okay. And
that's a good place.
Education, the people that have the training aren't being the ones listened to. Okay, we went to the county. I went down to the lower levels to the community, and I brought this because we need to do exactly as Lisa said. We need to find a way to bring it to the people. And if the big county won't step up and do it, then let's go to the people that will and show the people, the citizens of this community, that we care about them.
The one thing I would say, Ed, I actually really hear where you're coming from. And, you know, I would say for each municipality that believes that it's important to reach out to your county representatives, because it is the practical thing to do at this point. It's just the science. It's not really an emotional thing. But I do, you know, I can just add for you, for whatever it's worth, there has been some interesting research specifically on looking at the catchment areas for syringe exchange programs. And, you know, the catchment areas within a significant amount of people are within a half a mile to a mile, because a lot of people are not, do not have their own form of transportation. So it would not be as useful to have one location in the county. It would actually be more useful and more effective to have multiple locations near where people are using. So just for what it's worth, scientifically, that would be the most effective.
I agree with you. And the county has got a lot of places within the county. They could have multiples.
Sure.
I'm not against this. What you're saying is all good. You know, I don't want anybody to suffer. We don't need people dying. We got to help our people who are, you know, for whatever reasons got into substance abuse and can't seem to get out of it. And I think that's all good. I'm just concerned that, you know, the pioneers take all the arrows. Occasionally, they get the gold mine. And what you're asking is us pioneers to take the arrows as such.
Ed, I
And
don't
I'm
think
just
it's gonna
saying,
cost
with
the
a
village
$50
of
million
Homer anything.
budget at the county. No,
Ed,
I'm not
Ed,
looking at money. You know,
the county
this doesn't
hasn't
cost us
provided,
anything.
but I just want you to know that the county hasn't provided any support financially for substance use disorder in Cortland County in 11 years. The county provides no
I
funding for this.
understand. That's pretty
No,
sad.
I think we're
is
making
pretty
it.
sad.
We're doing the best we can. And we are accessing as much as we can in terms of grant funding to provide the supports that are needed. And we're happy to do that. That's why we do the work we do. But I think, you know, what we're not saying it's going to be in the village of Homer and nowhere else. I think what we're saying is we need to be where everyone is when they have the needs. And Homer is one of those locations. And we hope that you'll just endorse the idea so that you tell the people of Homer that you care about those that need the supports and that we will provide the services. You don't have to.
I understand we're not supplying the services. We're providing the location, and Homer is very generous to a fault. We're very, you know, we
It's
have a
very
lot of
similar to
excellent
the
people.
drug. And it's very similar to the drug take back. I think that
I'm not
initially the drug
against
take
this.
back. Well, I want to make sure that people understand it's a lot like the drug take back concept, which at first was a little controversial, and I think has become very successful. I just think, you know, this is an opportunity for us to really come together as a county and provide support. And I'm grateful to have this conversation, by the way. I couldn't be at the Cortlandville meeting last week, so I'm grateful that you all are having this conversation and you're being thoughtful about this.
And
Entire
what is Portland, the city
conversation.
with 17,000 people, what have they decided to do?
Well, again, this is right. Should the city be doing this? Yes. Should the county be doing this? Yes. But we can't make them do these things. We can only deal with what's within our own jurisdiction. So Matt has had his hand up for quite a while.
Sorry, Matt.
Oh, that's okay.
Yeah, so I just want to kind of reinforce a few things. I know we sent you a report that kind of outlines some of the local data, the research on this. And one thing I want to say, you know, I think at the last meeting, it seemed like this was presented as some sort of debate, right? This is a subject that's being debated. From the public health standpoint, and this is something that Anna said earlier and others have reinforced, this is not a debate. This is settled consensus science. This is supported by the CDC, by the New York State Department of Health, the American Medical Association, the World Health Organization, and our local health departments. You know, we have a statement of support from our local health department saying that they are supportive of syringe exchange services and in the programs that they provide. And I think what we need to, you know, reinforce here is some things that Lisa have said. Yes, it's about getting people, you know, having people get safe supplies and the needle exchange piece of this, but it's really about those supports that we're going to be providing people, getting them access to Narcan, getting them access to treatment services. That's really what a syringe exchange program can provide to the citizens in Cortland County. So they're not having to go to other communities that have these services. You know, right now, the staff does serve Cortland County residents, just not in Cortland County. You know, they are making their way to Ithaca or Syracuse or Broome County to access these services. We're not providing our citizens with the supports that they need. And to say, you know, we should maybe wait for the county or the city, I understand that mentality, but we've been waiting and we're going to continue to wait for that to happen. In the meantime, our citizens of Homer, of Cortlandville, of the county are still going to be experiencing these problems. You know, the opioid crisis has not gone away. The needles in our community are not going away by not having a syringe exchange program available to the citizens of Cortland County. And that's what we really need to be talking about. You know, as Anna and others have said, the research, there's a lot of positives. It's all about the services that go along with syringe exchange. You know, getting people access to treatment, recovery services. It actually reduces the amount of syringes in a community as opposed to those who do not have syringe exchange programs. There's no increase in crime, according to the research. Illegal drug use does not increase opioid overdose deaths when done in conjunction with naloxone distribution, which is what we would be talking about here. So all of the research, all of the public health consensus is in support of syringe exchange programs. And I really just want to emphasize that point that to do the things that we need to be doing, getting people into treatment in Narcan, the things that we know, this is a very hard population to reach. One thing District Attorney Perfetti has been going around the community talking about bail reform and the problems that has caused our community. Well, one of those problems is we can no longer reach a very hard population. Well, this would be one answer to that. We can get access to people that are not getting services in other means, and that's a really important thing. These are marginalized populations that need as many services we can provide, and this is just another avenue to do that. So, we provided kind of an overview of some of the research and the consensus, but I really just want to reiterate this, that from the public health perspective, this is settled. This is not a debate. We're in public health. We're not debating whether this is effective or not. We know it's effective. Now it's just up to the leaders like you to implement it.
All right, I like it. And given that it's so okay with the health and all that kind of stuff, and it does prove out that, I recommend we put it on the green every Wednesday night. That's where it should be done. That way the people from Homer can walk there. They don't have to drive, and that would be great.
The only issue with that, just to share, and you might check in with the law enforcement of municipalities that have done this, and some of the programs that have done this. Having a facility where the physicians and the nurses can be present to provide onboarding for treatment, provide mental health services supports. They need to have a facility that they can work from. And
Anna,
it
can I address
really
this?
does help. Just hold, let me finish, and then I'm happy to, because I have to jump, and then happy to pass it on. The other is having a bit of privacy, because asking people to masquerade in public can be breaking down of trust, and will reduce the effectiveness of the program. And it might not feel that way, but it could feel that way to people who are coming into a Central Park in a tent. So I just wanted to point that out, that the programs are designed the way they are in the facilities that they are to provide some modicum of privacy and confidentiality, and avenues and opportunities for accessing treatment and onboarding of treatment. So just putting that out there when you guys are considering, if you do move forward with this, when you're considering locations, that's really important.
If this is so great, then we ought to do it in the public right when we do our concerts, so lots of people can use this. If they really think this is so healthy for everybody, we ought to do it in public.
Yeah, that just doesn't follow the science.
I'm not too keen on it.
I understand, but that doesn't follow the science. No, I mean the science, but that mechanism of that infrastructure doesn't follow the science of what structure is necessary for an effective program. But I will let Lisa take it from here. I really appreciate the time.
So you got to sneak around in some back alley someplace where you can hide.
Ed,
all right.
If I could just say that, thank you, Anna. I just want to assure the folks on this call that we've been doing this with Narcan distribution for some time. So what we've been trying to do is have our unit, our mobile unit there, our primary care physician there. We've been trying to do food distribution there, and we've been trying to add other services such as CAPCO and DSS to sit with us in a setting where people feel like they can get multiple services provided to them at one time in a very accepting environment. And then if they want treatment or if they want access to treatment, we can provide that to them in a way that is confidential but supportive. So, I mean, I think that the people that we're dealing with oftentimes have many issues that we could be dealing with or helping support, such as food insecurity, such as access to primary care. So our goal as family counseling would be to try and coordinate every opportunity with John and staff to make sure that the services that we're providing are confidential, supportive, and all-encompassing, and address the issues around transportation, especially in the wintertime. I just think that we've been out in Truxton, we've been out in Cincy, we've been all over the county trying to provide these services. And I think, Ed, you're right. If we can provide this in an all-inclusive environment, that's better for everyone. I agree with you. So please do understand that, be assured that we will be a part of these conversations, that I'm hoping we can bring our primary care team to the forefront, and that we can provide an array of services that provide confidentiality, but overall supports food distribution with Catholic Charities and CAPCO, preschool information and other information for people who have needs. So please be assured that if we do these, they will be highly coordinated, highly supervised, but also offer that confidential piece for people who really feel they need it. And not just for needle exchange, but there are folks who are embarrassed to go to our school-based clinics, right? Because they don't want their teacher, their daughter's teacher to know their son or daughter may be experiencing mental health issues. So, we offer information on our mental health clinic and our mental health services in our school-based clinic. So your point well taken, Ed. We want to make sure that we are providing an array of services in a way that's very inclusive, but also offers that confidentiality. So please be assured that that's the way we will coordinate with staff to make sure that those services are provided.
Anything else from anyone else care to speak on this?
I do have some questions when everybody's done speaking. I think Sarah raised her hand.
Yeah, so I'm probably going to mention a lot of things that previous people have said, but I just wanted to speak from my standpoint. So I work as the project director of Healing Cortland, a project of Cortland area communities that care. So Healing Cortland is an initiative in Cortland County to reduce opioid-related overdose deaths. It's part of this much larger initiative called the Healing Community Study. So a few years ago, Cortland County was lucky enough, and we're really excited to be participating in this groundbreaking research study funded by the National Institutes of Health. So 64 communities across 4 states are participating in this research study, where local communities are being asked to implement evidence-based strategies to reduce opioid-related overdose deaths, but trying to figure out how can we implement these strategies in a way that works best for local communities. So there's small rural communities like ours, there's big urban areas, and we're really excited about this. This is an opportunity to try to hopefully do some really impressive work. The goal is to reduce overdose deaths by 40%, which is quite ambitious, but it's important because ultimately people are dying. The project is focused on 3 main areas. So increasing access to overdose education and naloxone, increasing access to treatment and specifically medications for opioid use disorder, and working on safer prescribing practices around opioids. And then wrapped around this is doing work around community awareness and especially around reducing stigma, because what we know is stigma is one of the biggest barriers to implementing these things that research and data shows to be effective. Quickly, I'm going to talk about our process at CACTC. So we're a data-driven organization. At CACTC, we work on different projects. So my project is focused on opioids. We also do work around underage drinking. And we first conduct these needs assessments. So we collect the data, we work with community partners, and we try to understand what is happening in our community. And then when we have different strategies that we think will be effective, we work on these strategy reports, similar to the report that I shared on syringe exchange programs. So it summarizes local data, it looks at what the research says, and then we go about it in a very methodical way. So this is not based on emotion. This is not based on what we think might work. This is really to our best ability, finding what we, have really good reason to believe is going to be effective and good for our community. And so that's what the Syringe service program report that we sent to you is. That's a work in progress, but that was our attempt, in a month to really summarize and really dig into this. And so that's what I shared. So why do I care about Syringe service program? So even though it's not one of the main focus areas of the Healing Community Study, it ties directly to some of these other interventions. So as you heard, it's a mechanism for ensuring that people that are highest risk for overdose, so people who inject drugs, have access to naloxone. And that is so important. And currently we know that a lot of clients are going out of county, but there's many more that are not being serviced and might be getting Narcan kits at family counseling or other service providers. We need to be increasing the number of people that have naloxone, and this is a really important mechanism. Another one, as I mentioned, was increasing access to medications for opioid use disorder. Well, a syringe service program is a great mechanism for, identifying people and connecting them to treatment. Is so important. And so for me, this is all about creating an ecosystem where people have the services and supports that they need. This is not just the solution. This is part of a much bigger puzzle. And it's, we've known for quite some time that this is a program that Cortland County needs. And what we really need is the leadership moving forward on this to make this happen, because we have a program, we have staff that wants to come in and increase services. We have treatment providers like Family and Children's Counseling Services, other community partners that are desperately saying we need these services, and we have the clients. A lot of us are working with individuals in the community, and we know that these are services that people that desperately need. So that's all that I wanted to add. Thank you so much for speaking about this and taking the time to invite us and listen to us. Thank you so much.
Thank you. Thank you for being here. Would anyone else like to speak on this before Pat starts asking questions? Dean?
Yep.
I'm sorry, I didn't see your hand. Yep.
No, that's all right. I want to thank everybody that came and spoke tonight. The people that are educated and professionals in this field that truly understand it and can help relay the proper information. I know last meeting was interesting enough and emotions rose. I try not to let my emotions rise, because to me, this is very personal, not because I lost my son, but because it's about saving lives. It's about other parents not feeling what I feel and other families not affected by the loss. You look behind me and there's a banner, and each one of those faces, each one of those children, their parents put them there because they want to hope, in the hope of saving just one life. And they'll tell you that, every one of them put themselves out there, their own pain. When you look at me, I know I'm only one person and I'm a father that lost his child. But what you don't see is the 150 other parents that I work with directly, the 150 parents that are supportive of this and just don't have enough to deal with the emotions and strength to go on and fight this and to put themselves out there in that way. But 100% thank me for going out here and doing this. So I want you to understand, when you look at me, you're looking at 150 other parents that lost a child, easily 150. Everybody gave some great data and information, which I think is important for all of you to hear. There's a couple things that I want to point out, and that's every single person from a New York State Assembly member who makes the laws, who is a doctor, who is educated, and literally is about the facts, is explaining to you that this is all positive. Our own local head of family counseling stands up and says that this is a triple win. These are the people that are educated and professionals in this field. The last meeting, we had 3 people come forward who are professionals in the law, professionals in public safety. This is not a public safety issue. This is a health issue. This is where I sit in a SIMS meeting and hear 85% of the people in and out of our jail are substance abuse and mental health issues. When does our county, Ed, you wanted to know where our county, when does our county stand up and get ahead of the problem instead of repetitively chasing it and putting Band-Aids on it? That's why I'm pushing for this, Ed. That's why this is important, because this isn't a Band-Aid. This is actually trying to get ahead of a problem and trying to help save lives. This is something that they've been supported for over 30 years of data, and our county will not touch it for whatever reason. So yes, I bring it to the smaller communities where we can reach the people that need it. You talk about putting it on the green, and I hear in your tone there how
sarcastic.
Yeah, okay. The reason we're choosing the outlying border is so that the people in Cortland community can walk to it or get to it easily enough, because the city officials will not step up and do something. That's why we're here. That's why I went to Cortlandville. This is why I'm at Homer. Cortlandville surrounds the entire city of Cortland. Okay. Homer, right in there is a nice spot. McGraw, anywhere, Cincinnatus, any of these places in our county should be looking at this. You're 100% right. But where do we start if we can't start with the smaller communities? Today's world, every single overdose death was preventable. We have all the tools for it. It's the policies and it's the procedures that are made that are what killing or saving people. That's what you guys are tasked with today. What policy, what will you support? What procedure will you go? It's not an easy decision because it's not understood by everybody. You guys have a much better understanding of it tonight. And I hope in that you'll reach out and you'll do something to let other members of this community that need to know they're cared about just as much as the business owners that are trying to make the money. They need you guys to actually come forward tonight and let them know that they matter. And that's just one more step of helping them get to the road of recovery. I thank every single one of you tonight for listening and everybody that came and helped to educate. Thank you for your time.
Thank you, Dean. Lisa, did you have something else?
Yeah, I just want to make sure that everyone's aware of the fact that we are having conversations with the city as well, that we're having conversations with the county. In fact, the county has invited us to present on the 20th about additional supports for these types of activities. So this conversation is very helpful in terms of allowing us to open the door to other conversations that I think will be fruitful. I think we all know the definition of insanity, continuing to do the same thing and expecting a different result. I think that these are really good conversations because they're allowing people to feel comfortable to have the conversation. And I don't want anyone to think that we are not advocating on a statewide, on a local, on a county basis when it comes to changes in policy that will allow us to support our people. So, you know, I'm sort of proud. You know, I lived in Cortlandville. My husband and I lived in Cortlandville when we first moved here. We've always wanted to live in Homer because it's just, who doesn't want to live in Homer? But, you know, having the small villages be the leaders here really does show the county and the city that these are conversations that need to be had. You can be the leaders here in helping us continue to engage in this conversation and provide supports for our people. So I think that's an exciting thing.
All right. Anyone else? Okay, Pat, fire away.
All right. First of all, I want to thank everybody for coming out here tonight. As we all know, this is a bit of a touchy subject. Part of it is education, part of it is not understanding. So the more conversations we have on this, the better it is. Some of my questions, and I'm going to put these questions out, and so whoever has the best answer, please just respond and work with me on some of these things, as I will gladly plead ignorance on this, just as long as we get to the answers that we need, because we as the trustees are going to have to go back and talk to our constituents about this, why we voted for it or voted against it. But I want to make sure we have as much of the information as we possibly can. So my first question is, what are the metrics for success?
I would like to say that for my agency, one of the metrics of success is getting more people into treatment. But we have, to be honest with you, such a demand for services that that's going to be a metric that's very easily measured, because there are so many people that are coming to us for services. There are so many people who in need of services. Certainly, a decrease in opioid deaths or opioid overdoses would be a huge metric for us that I think would be a value to measure. Matt and Sarah, I'm sure you have more specific data on that would be helpful in terms of measures through your work.
Yeah, so I mean, I think I can jump here and offer something that we also looked at for Cortlandville when that town board approved this. I offered up our services to track some of what was going to happen with the syringe exchange program to determine what those measures are. So as Sarah said, you know, we follow a very deliberate process at CCDC. We would be looking at all of the literature and research. There's a very specific set of criteria for what are deemed effective syringe exchange programs that have clear measurements. And we would be getting all that information from staff to effectively say, you know, is this having the desired outcome that we want? And we'd be more than happy to report that to this board on a regular basis to say, you is this increasing Narcan distribution, for instance? Is it leading to referrals? Are there Hep C testing that's happening as a result of this? Those are all metrics that we would be looking at. There are sets, of criteria that we would be measuring as part of our work, because we're going to do that regardless. And like I said, we'd be happy to assess that and report that to this board so you can determine, is this something that's going well or not for our community?
So we could do this at, like I say, a 6 month and a 1 year. You guys can give us a report and then we can determine whether or not we think this is good for our constituents.
Exactly.
I would suggest a 1 year at least initial attempt, simply because oftentimes people are wary at first about these types of activities, and you need people to feel comfortable and to know that. So if we're going to be there with food distribution and primary care and treatment and needle exchange, that people get an understanding of what's available to them, especially as we head into the winter. But absolutely, I think that makes a lot of sense to be able to report back to you all.
And point out that this isn't going to be a flip of a switch and everybody's just using it. It's going to take a little time to get it up and going and the word to spread and people to trust it. So
I think trust is an issue. Yeah.
Yeah.
My other question is, how are the needles accounted for?
So the syringe exchange programs run by the Southern States Aid program are highly regulated by the New York State Department of Health. So they have to account for all the needles that go in or go out and all the needles that come back. Their staff is trained to do this. They have to account for all of that. That's how they calculate the percentages of the return rates. All of this is regulated. As John said in his letter, they've never, they're up to date on all of those regulations. And so this is very, very highly regulated. They have to report all of those numbers to the state agency to authorize.
Out, let's go.
And just so you know, we have to do the same thing for Narcan. So when we distribute Narcan, we have the same level of accounting through the Department of Health. We have to know who's been trained, how they've been trained, how many kits have been utilized, when they're utilized, and we have to report back. So it is very highly regulated.
Okay, because I know when, one of the previous conversations we had, it was to reach out to the other, or like Johnson City and some of these other locations to get feedback from them. And there was some discrepancy on the needles that they didn't have the same strenuous oversight, that they were, one needle would come in, 20 needles would go out. I just kind of want to look to see that, that's not going to be the case here.
And I think John mentioned that too, that every needle that goes out has a code on it that needs to be traced and followed. I mean, it is very highly regulated and we are held accountable for those standards.
So I will say that it is not necessarily a one-to-one exchange. So if somebody doesn't, and actually the CDC, it's not considered best practice to just do a one-to-one exchange. I think on paper, sometimes that can look good, but the reality is somebody needs, sterile syringes, you give them sterile syringes. But like what John has said is that it's about building that relationship. So that first time they might only get 20 syringes. And then as they're returning what they should be, they're allowed more and more. And then there are mechanisms, I do believe, that if somebody isn't returning, they deal with that. So it's, it's part of working with the clients and so on. But again, they're not handing out hundreds of syringes and then never getting them back from clients. That absolutely does not happen. But it is not necessarily one-to-one.
And that's also why having a treatment opportunity there as well at the same time is really important, to be able to talk through that with the clients and make sure that they understand where they can go for services or that we can go to them for services. So that's that added benefit of having the Cody team there to be able to talk to those folks.
How often, would they provide fentanyl test strips?
I provide fentanyl test strips, okay, just so you know. Okay, I have a Narcan program. I supply fentanyl test strips. I'm sure they will be able to supply them.
So
go
ahead. And
yeah, I believe family counseling is also providing some.
Yes, we are.
Fentanyl test strips at this point too. So that would be, I believe that's part of the program. If someone asks for that, they will have those available, and that would happen. I think we also should clarify too what we are talking about with the exchange program. We're talking about a mobile site. So this would be a mobile van that would come in. We're not talking about a structure or a building here at first. And we're we're probably talking about once a month to start. This is not going to be, a weekly occurrence necessarily. I think this is going to be a new endeavor for staff, and they have to understand what the resources they have are. So we're talking about once a month, at least to start. So I just want to clarify that as well.
Yeah, and I'd like to point out in the previous conversation where it was explained that there's no accountability, it's a state recognized number of percentage returned by that program. Okay, so there is an accountability of what comes in and what goes out overall. And I think that's where that number comes from. The other thing is that just keep in mind, it's just harm reduction. When you bring up fentanyl test strips, it's just another form of harm reduction. It's another form of saving lives.
Well, that's one of the reasons why I bring that up, and I wanted to know if that was going to be part of it, because I read another study, 2019, that showed a correlation with the SSPs and the decrease in the viral
Matt got this.
the viral hepatitis, but it actually showed an increase in the overdose deaths. And
So
I know part of
if
that
I
was
could,
increased.
I can address that paper. I'm familiar with that paper.
Mhm.
There's a few things that you have to be aware of. One, this is not a peer-reviewed research paper. This is a working paper written by an economist in 2019, where she took a bunch of data, ran it through some complicated statistical models, and came up with estimates. Right, this is what common practice in economics. That is not written by public health. The overwhelming, again, public health consensus is that this has positive impacts on overdose-related fatalities. So I won't get into the technical details of some of the problems with that paper, but to put it simply, she omitted a lot of things that we are talking about here. So she didn't factor in, are they given Narcan? She didn't factor in, are they referred to services? She didn't factor in, are they given fentanyl test strips into her analysis of the data. So that's what we would call omitted variable bias in my world, and that's really problematic. So, I've read it. My epidemiologist also read that paper here at CCDC. We have a lot of problems with it, and I just want to kind of address some of those things. That what we're talking about here is all of those wraparound services that go along with a syringe exchange program, not a syringe exchange program in isolation where we're simply handing out needles to people.
And that's one of the questions why I brought up the fentanyl strips.
Yep.
Because, and by the way, Matthew, I read your thing, and that was one of my questions: is how many of these other services, how many of these other wraparound services are provided with this SSP?
Well, so that's what I think Lisa's really been talking about.
Right.
Staff can offer what they can, but we are really we see this as a coordinated community-wide effort. So, staff is going to come in with the services they can provide. Family counseling really offers some of the access to treatment and recovery services. MOUD, they're going to be committed to that. Narcan distribution, we're really going to work at the community level and through our partnerships to make sure we're providing as many services as we can through this program.
And Seven Valleys and Catholic Charities are committed to bring in food distribution at the same time. So, I think in particular, those are additional services that people have needs that aren't being met, that we will be able to roll into this. And that's what we've been doing with Narcan distribution for the past year and a half. So we've already sort of tried and we've had some successes. So it's sort of exciting to think that we can actually expand the access to those services at the same time.
Would we have a list of what the services will be as part of the wraparound for the SSP?
Absolutely.
Sure, yeah.
My other question is, how is this paid for?
Yeah, so this would be the actual syringe exchange, service is at no cost to the community. Staff is a funded provider. We are one of in their catchment area for them to provide these services in Cortland County, as long as we get the kind of support of the local communities. So there would be no cost to Homer or to the county. It would really be relying on the services and supports that staff already has. that's really why we're probably only talking about once a month, at least to start. And so then, John and staff can start looking for additional resources to potentially offer more days in Cortland County as needed, but there would be no cost to the community.
And just so you know, for our Cody vehicles, they are funded by the state at this point. We are looking at additional state funding potential and also at county, potential county funding. Again, we'll be presenting at the county ledge on the 20th to try and make sure that our mobile units are continued to be funded. But we are committed to continuing to provide those services. When OASAS started to fund the infrastructure around the mobile services, they focused on capital, which means the vehicles and the training for the individual staff members so that we could continue to provide the services and potentially bill for the services after the grant funding might go away. But we're continuing to look at grant funding. We don't anticipate Cody services going away anytime soon. Certainly the United Way and Catholic Charities and CAPCO are also continuing to be funded by state and local grants, as well as private foundation grants. So, we don't see that as an issue. It's part of the infrastructure that we've created over the past 20 years in the community.
All right. We heard from DA Patrick Perfetti about the Angel program. Now, of course, we're talking about SSPs. And Lisa, yes, with you being the county, the closest thing to a county rep right now, are there any other programs that we have in the county that deals with, outside the Angel program and this proposed SSP, do we have any other programs in the county that deals with drug abuse?
So we offer very comprehensive addiction services, both in group and individual settings. The Angel program is a great idea and it's a great concept, and I'm so glad we're able to provide that. And I know Dean is one of our angels. We have another couple of angels out there who are willing to show up in the middle of the night to provide services. But a lot of folks don't really want to access services when they are. The Angel program has not had a large participation rate. So that means that we're not hitting them, we're not finding them where they are. We're using punitive measures as compared to using, the opportunity to reach them when they might really be willing to listen and have gained their trust. We do have.
Hold on, I understand that, but I'm like, what other services are out there? We have kind of like the two extremes. We have the Angel program from after they've been, caught or incarcerated, and then we have the SSP, which is, do we have any other programs in between?
We serve about 10,000 people a year in our addictions clinic. So yes, we have extensive programs at our clinic in at 165 Main. We're also providing a lot of health services right now, which is really terrific for those folks who can't get out or afraid to get out when it comes to COVID. We're providing school-based mental health and addiction services in every school building in Cortland County right now. So we are meeting a lot of parents who have addictions issues. We have a program with Cortland County DSS where we're going out with child preventive services to try and do interventions with parents who might be at risk of having their children taken away because of substance use services. So we're providing those interventions to try and get those folks to access treatment. I think we also have SRS, which is another very robust addictions clinic in Cortland County. And we have the Cortland County Mental Health Clinic. So we do have some very extensive opportunities for folks to access services. We're also working very closely with Family Health Network with integrating primary care from their facility into our community-based service at our clinic. And again, with our Cody vehicles, we can go just about anywhere anyone is and meet them where they are to provide services face-to-face.
Now I'm going to put Chief Pittman on the spot. Chief reached out to several law enforcement agencies that have this in their community and got their feedback. Chief, do you want to summarize that and give us your opinion on this?
Well, I reached out, as you're well aware, I reached out to 12 agencies. I went to the state's website to see what areas have a needle exchange program, emailed the chiefs or the sheriffs in these 12 different agencies, just 5 generic questions, what people would be interested in. Is there an increase in crime? Is there an increase? Is it attracting people to the area? Are you picking up more needles? Escapes me the other questions. And it, despite what Mr. Berry had said, that I didn't get a negative response about the needle exchange programs from each of the chiefs or sheriffs that responded to me. Actually, out of the 12, I had 5 respond to me. And to summarize it, there's really no increase in the crimes. One municipality in particular said they are picking up needles every day. Another had indicated that on occasion people are getting the needles and they're finding them in the close proximity where they've overdosed. I mean, my main concern would be the disposal of the needles. I mean, we are right now in the village, far and few between, getting complaints of discarded needles, and I just don't want to see an increase in that because, that's my main concern. So I mean,
I will tell you that we've had. I think based on research, you would see a decrease in needles if you're seeing them at all.
I know what one municipality had said that the needle exchange program that's there is less than 50%. I mean, that is an alarming number. I know you guys had mentioned, I heard 104%. I've heard 106%. Less than 50% is a little alarming to me. But I mean, it's going to be up to the board to, reach out to the different municipalities to, so you guys can make an informed decision on this. And again, each of the agencies that responded didn't really say anything negative about the program.
I just want to say a couple things. I appreciate Chief Pittman and he and I have had different conversations about some things like this in the past, but I'll say from a public health perspective, no intervention, regardless of what it is a silver bullet, magic bullet that's going to solve every single problem we want to solve, right? It's a tool in an arsenal of other things that we have to combine together. So I think what we have to ask ourselves by not having one of these programs, have we seen a reduction in needles in our community? I mean, I think the feedback that we've all gotten is that the answer is no, right? And so if there's even a small reduction in the amount of needles, I think that's going to be a positive. Are we going to see a 0%, are there going to be 0 needles in our community? I think it would be foolish for anyone in my world to say that. I can't make those predictions. Will you see a marginal reduction? Possibly. I think that's what the research suggests. To the rates, not every syringe exchange program is created equal. That's why research is done. I think the average that staff, the agency that would be running this needle exchange, averages a 90% return rate. So I think over 90%. So let's just, I just wanted to throw out some of those tidbits.
I'd like to point out a couple things, and one, I'd like to point out that this isn't just about people that are using drugs. The diabetics have an opportunity to get their syringes through this program. Okay, elderly that can never seem to find a place conveniently enough or not a hassle to dispose of them will have a location they can go and dispose of their needles as well. So it's benefiting the population as a whole. Okay, a lot more than just this niche that we keep talking about. And I think that's important to remember, especially when people have those arguments. Well, you give Narcan, how come you don't give the diabetics their stuff free too? Okay, when you hear those arguments, it's important to sit there and say, this is one of those programs that will help in that. Okay, the other thing is that's important is the community actually supporting this program so that it is functioning to the way that it could be and people are willing to go and use it. So I would say there's some sort of a campaign that we should put together and let them know it's here for them and that we're here for them. And the more that we're able to do that, that's going to also help the program to succeed and do exactly what we want it to. Okay? So, the place that's doing 50%, I'd like to know more data on how the community is working with it. I know that Ithaca, I think most of us know that Ithaca is pretty open on things, and they've been working to help their population that's in need of help. And I think that's why they have such a success of 104%. So I think that should be kept in mind and go back to, this is a health issue, not a public safety issue.
All right, Ed, go ahead.
What would it take to go to every 2 weeks or 1 week for this thing? Because once a month doesn't sound great to me.
Well, first off, just like every other business, restaurant, and everywhere, they're having staffing issues right now. John already has told me that when he's able to come in and gets a location, he's most likely driving the van in personally himself to do it. So right now they are having some staffing issues. He can do us once a month right now. As his funding and staff allows, that may be able to pick up and change and benefit us even more.
And I think, Ed, if I could just answer that briefly, I think what we would be looking to do with staff is to really, we're trying to do mapping in the county as to where a lot of the activity is occurring. And we would be trying to base our service areas and our timing on where the needs are most acute without letting any other areas go dark, right? So we would be trying to do it based on statistical analysis. So if it looks as though there's an outbreak in Homer, we could leverage these mobile vehicles and get them out there as needed and try and provide those support. So I think we would be looking to base it not on a specific calendar, but more on specific need in a community.
All right. So you have one van or 2 vans?
I have 5 vehicles, and
Oh, you
staff
have 5.
has
No,
staff has how many? Staff has how many? Matt, do you know?
I do not know. I mean, they would be servicing it with one van at this time. I mean, those are details that would have to be worked out with John. And as Dean said, as more resources become available, as they come into Cortland and there's a need that might justify additional funding on his part. There is going to be more federal funding coming down for programs like this.
Absolutely, and more state funding with the opioid settlements.
So we anticipate that there's going to be additional funding available for these very types of programs that could lead to more, service area days, all those things in Cortland County.
And right now there's the opportunity, and I'm sorry to interrupt you, Ed, I apologize. There's also the opportunity to call our Cody team at any time, and we anticipate being able to provide more services through Cody and its Centers of Treatment Innovations. It's a state title. It sounds ridiculous. Nobody knows what Cody means, but Chief can call our folks during business hours or off hours and get somebody out there to talk to an individual who might be experiencing an overdose at any time. We have those mobile services available right now, not just with the needle exchange piece, but with mobile services.
What I was really kind of trying to get to is helping you in the county of figuring out, hey, if you needed 3 more vans, or 50,000 a piece, there's 100,000 per employee, blah, blah, blah. What kind of monies do you want to present to the county to say, hey, if we really want to do this on the county, it's going to cost $2 million or $1 million or 50,000. I don't know, but you got to buy some vans, you got to staff it, you got to do all that. 1 van for the whole county probably sounds a little light.
If you ever want to come over and get it,
with the county.
I appreciate that and we will be presenting on the 20th. By the way, if anybody ever wants to come over and take a look at our mobile vehicles, I think you'll be very impressed with what we have in terms of options when it comes to telehealth and the vehicles that we are able to drive around and provide services. Please don't hesitate to call my cell at any time, and I'm happy to show you what we're trying to accomplish over at Family Counseling throughout our county and through Madison County and in Broome County as well. So please don't hesitate. If anybody's interested, I'd love to show off these vehicles. They're beautiful. They're smart vehicles, and they are being utilized.
I'm just saying, once a month sounds like.
Well,
are these drug addicts? Well, I don't mean to say that, but I mean the people who need to do the exchanges. Can they wait a month?
So I'll say this: once a month is more than what we have right now.
Yeah.
Exactly. And again, and if we do this, there's nothing to say that if for some unforeseen reason it's catastrophic failure, we can stop, right? It's not like we're committed in stone to forever with this, but it's worth a try. It's, and it's proven that it works. So I really would encourage the board to approve this. Pat, do you have any other questions? I'd like to wrap this up and vote on this.
I do have a couple more questions, but they should be short ones. One, how is this advertised? How does the information get out to the people that need these services so they know time, place, location?
And I think that's what we would have to figure out once there's the approvals in place and we have a plan. I think that's where we're going back to the coordination piece. Our agency, Sarah's leading the Healing Communities projects, family counseling, CAPCO, Catholic Charities, having coordinated meetings. We've done this exact same thing around Narcan. A year ago, we started promoting in coordination with family counseling services the pop-up Narcan events. And so there's just, once we have the approvals, then you put a plan in place. My agency has a lot of experience advertising the drug take-back events in coordination with family counseling, Narcan pop-up events, all these things. Once we know that it can happen, then we can develop the plan to how do we actually get the people aware of this. Dean obviously play a role in that, through the service providers. That's what we do. I don't know really else what to say other than once we have it in place, that's what we do.
Okay.
Word of mouth.
Pat, Pat, I also just want to say that we are working very closely with Guthrie to make sure that whenever there's an overdose or whenever there's an issue around, and with Family Health Network too, that an individual who may be addicted and who doesn't know where they can go for services or doesn't know where they might go for syringe exchange, we are working very closely with the entire public health community to make sure that information is out there in a way that people have access to it. So whenever we do a Narcan event, for example, we include a full array of pieces of information in that kit. It's a plastic baggie that we put together that has all the information that anyone needs. When we do a food distribution event, we provide that same information. When we do any type of public event for family counseling or for Catholic Charities or for CAPCO or for Guthrie, we make sure that all that information is in there. So this will just add to our arsenal in terms of being able to provide additional information for folks. The infrastructure is there.
And it's important to know word of mouth when trust is being built among the program with people that need to use it. That word of mouth is going to help that spread. Not to mention all of our local doctors, we're going to be able to get word out to them. They're going to be able to let their patients know. So it's just a matter of that time and having a campaign ready to go, which is, like Matt said, the next step.
My next question is partly with Chief Pittman here, because we had this discussion about needle reporting, and part of it goes into the Spillman system and how the 911 operators input the information. And in order for us to have accurate data, part of the things we need to make sure is that it's being reported correctly at that level. So that's just more of a statement that needs to be taken up, I think, maybe at the county level when they're doing this. If we're going to be doing a needle exchange, we want accurate data. We need to know how many calls that we're actually getting for found needles, and if we can see that the trend is either going up or going down. The last thing I have is that I read one of the articles that Chief Pittman sent, and it's not a surprise to anybody, but we are on track for the most overdoses. As of July, we had 4 deaths and 47 ODs that were reported. And that's just the stuff that's reported. So we're looking to break last year's record, which is a sad record to break. So I think if we can add another touch point to try to break the cycle, that would be a good thing. And that's the last of my questions.
Great. Thank you, Pat. Very good questions. Any other questions from the board? Comments? All right. I would like to entertain a motion that we do a 1-year trial with the needle exchange program.
I'll gladly make that motion.
Do we have a second?
I'll go ahead and second that.
Thank you, Pat. All right, any other discussion?
I personally think we probably ought to punt on this and see how Cortlandville works out. But I'm not against it. I just like to see the data. So I definitely don't want to see Homer get hurt. But I don't know. You don't know. I'd like to punt personally.
All right, well, no punting allowed. We're
That's
just gonna
only one vote.
So, all right, we'll just go around.
I guess we do get a choice in the location of this.
Yeah, of course. Yep. We do. And again, I think that the location that we chose makes the most sense, which is down, towards the Cortlandville end of the village, because it's closest to the city and the density of population that will probably utilize the services. And that may change if the city gets off the schneid and does this as they should. It may not be needed in that location anymore. And then same with the county. So, but waiting for the city and the county to do the right thing is not an option in my mind. So let's go around and vote.
I have one thing to say, if I could, please?
Of course, Kevin.
This is like with Dean, you're the parent of one, someone that passed away due to this circumstances. But what about the one child and the parent of that child that comes across a needle and contracts Hep C or AIDS, where there's something left in that particular vial and that child dies? What about that concept? That's what concerns me.
Well, and that's
Kevin,
why,
can I get,
that's
that's
the
why you
reason
do the
for
needle
doing this.
exchange, to keep them from being on the street so that people can't, we had one woman who's developmentally disabled who walked through the city of Cortland about 2 years ago, thinking she was doing a public service, and in one afternoon collected 2 plastic buckets full of needles. They're out there already. You may not see them, but the point of this effort is to make sure that doesn't happen.
I understand that, but according to Chief Pittman's statistics, that really wasn't quite as accurate as what you are presenting.
There's 30 years of data, 30 years of data that supports more needles will be disposed of properly than improperly. The other thing I'd like you to know is that the law has allowed for anybody to go to a pharmacy and purchase syringes. Okay. However, they left a loophole where they can still be charged for having a hypodermic instrument. And that is a big portion of why people are disposing improperly, so that they do not get charged with that. Okay, so there's a few combinations of things. We get law enforcement supporting this. We get the stop of that charge happening, which, so you understand, when there's somebody that's in this program, that card that the DA is all concerned about allows them not to be charged because they are a participant by law. Okay, so you're going to see a decrease, not an increase.
And we will be measuring this. So let's say 3 months into the pilot, all of a sudden Homer is noticing, that's a point where stakeholders are going to be brought together, and we're like, what's going on here? So, we will be measuring all of this and tracking all of this. And so at any point, if we're noticing something, there's plenty of opportunity to deal with that. But again, overwhelmingly, the research shows that's unlikely to happen. But if we are noticing little things, either it's the program stops or we need to engage much better with clients. There's all sorts of solutions to happen, but already there's an issue. It's unlikely that Homer is going to see a significant increase or any increase in improperly disposed.
So yeah,
I'm good with all that information for sure, but I don't want to be a friend of that parent or one of my grandchildren being a victim just because it was in this location.
And I don't want to minimize how scary that is, absolutely, but the risk of transmission is almost non-existent. So it's absolutely scary. I don't want to minimize that, but right now people are dying. Right now, Hep C is being transmitted from injection drug use primarily. I think that's the biggest concern. And we will do everything in our power to ensure that there aren't, that we can minimize any other type of unintended consequences.
Kevin, I understand you have that concern. And there's people that live with every day the concern their child's going to die because an opportunity for help is not there for them. Okay. I live with what have, could have, should have every day of my life when I wake up in the morning. What could I have done different? What should I have done? Should I have not have done this? And I'm not the only parent that suffers and deals with that on a daily basis. What you're asking doesn't have any data supporting. It's a woulda, coulda, shoulda. Okay, I get it. I understand it. But what about those people that live in fear that their child's going to die because they don't have an opportunity for that contact point they would gain in a syringe exchange?
Understood. Thank you.
All right, so Ed, how do you vote?
Punt.
So that's a no?
No, at this time. I'd like to see what Cortlandville does for the data.
Okay.
Then I'm
Kevin?
probably not against it otherwise, but I'd like to see how that works out with them.
Kevin, how do you vote?
Nay.
All right. Tim?
Absolute 100% yes, and I'll make the motion if need be.
And Pat?
Oh, the motion's already made. The motion's already seconded. My concern on this was that all the data that I was looking at was the concern about the Hep A, Hep C. It seemed to be secondary was the opioid overdose. And then with our overdoses within the county, my concern was that were we going to be adding, putting water on a fire, or are we putting gasoline on a fire? Because we're already on track to break the record for opioid overdoses. And then I have the concerns about the needles, but also part of these services produced is that you guys provide sharp containers for your needles. So with this, and the fact that we don't have any tracking mechanisms right now, but being assured that you guys will provide data back to us, I will vote yes, so that we see this on the 6 months and the 1 year, and that we would readdress this. And this is incumbent upon us that we address this throughout the process. I am for another touch point in order to break the chain of addiction for those that suffer from it.
You're a good man, Pat. I appreciate your thoughtfulness in this, and the fact that you did do a lot of research and ask a lot of questions and really took it very seriously. And so I appreciate that. And so then I have to cast the tie-breaking vote, and I vote aye. So motion carries, and we will work with staff and Dean and Cortland Area Communities of Care and Lisa, and get a program up and running. We'll see how it goes. I'm very optimistic. So thank you, everybody that came and spoke on this.
Gentlemen, thank you for your thoughtfulness here. And again, I want to make sure that people know that they can call my cell at any time. I'm happy to talk about questions, concerns, comments at any moment of the day or night. These are important conversations, and I really, really appreciate your thoughtful candor and your commitment to your community. So thank you very, very much.
Thank you, everybody.
Thank you.
Thank you, everyone.
All right.
Thank you, everybody. I hope you have a great night.
Thank you, Dean.
You as well.
Miles to go before we sleep. All right. Next on the agenda. We have the blue pantry pop-up presentation.
Appears to be a no-show.
Okay.
I will give a brief overview on that. Linda Jones, Mary Better's contacted Linda Jones about asking to put a blue box, which is one of the pantry boxes, into the village. I told her that it needed to go before the board. I am not a subject matter expert on them. I don't pretend to be. And having heard some things, I know this is definitely a board decision, so all for punting that one until they can present themselves.
What is this one on, Pat?
The blue pantry, blue boxes, they're like pop-up little food things. But there's a lot of questions that have to be asked. I know there's a couple already out within the county, but I am not familiar with it. I've been trying to get more information on it, but I don't have that. There are some differing questions about it, which I think legally wise, we would have some concerns with, but I don't want to muddy up the water any more than it already is. So until we hear specifically from them, I wouldn't want to discuss it further.
All right. Moving on. Next item, review and approve Auctions International. So we've got a number of bids for closed auctions. The recommendations we have are to approve all of them except for the Ford Fusion SE, and that is to counter offer for $12,000. Correct, Tanya?
That is what Mike wrote up. Bill and Bob think we should accept the offer that Mike thought should be countered.
Yeah, Bob and I talked about it earlier, and he's okay with the prices on the cars.
Yeah, okay. If he's all right and you're all right with it, then
That's correct. It's a Ford. We got to get what we can.
I feel like this is a long
Good
setup.
point, Bob. Good point.
Actually, both are good cars, and I'm very pleased with the offer. So,
hook, line,
All
and
right.
sinker there.
Yeah, I went for it. So, okay. So then based on that, it's to accept all 7 bids, right? 7 bids.
Yep.
We have a motion?
Yes, sir.
I'll make that motion.
All right, go ahead, Kevin.
You second, Tim?
Yep.
All in favor?
Aye.
All right, unanimous. Very good. All right, next up are budget adjustments.
So most of these are just moving them from one line to another. And then we added a budget when we did high key for recreation. So we added the dollars for that. But otherwise, it's mostly moving small equipment out of large equipment.
Makes
All right.
sense.
We have a motion.
I'll make that motion.
All in
Second.
favor?
Aye.
Aye.
Yeah, unanimous. All right. Next up, review the Earl Abbey bid. So the bid to repair the roof on Earl Abbey is $48,922, and they have a couple of other things that they are recommending that we add on. One is repoint the existing masonry and resetting 5 stones that have shifted. How much do we have in that account total, Tanya? Do you know?
Almost 97,000.
So we have plenty of money to cover it.
Yep. The person who wrote up the bid wanted to let you know that the masonry work really needs to happen ASAP, and they would need to know right away if you do vote yes. I also sent all the will documents to Dante verifying we could use the money for the roof.
You also what now?
It didn't go through, sorry. I sent all the will documents creating this trust to Dante, and he reviewed them, noting that we can take the money out for the roof.
Right. So my recommendation is that we do the whole enchilada. We do the 48,000 and then the 2 additional things as well, because they have the money in the account, and it's our responsibility to make sure that that structure does not collapse. And so to me, it seems like a no-brainer.
I'll make the motion that we approve.
I'll second it.
Discussion, Pat, you had a question?
No, my eyesight's just failing me, and I thought I saw a different number down there that I was a little concerned about, but
Okay.
I refocused.
Very
And
good.
we definitely have, man, just one last comment. We have been fighting this for years.
Yes, we have.
And to finally find somebody that'll touch it and do it, let's get this done and get this finished up so somebody else can worry about it 50 years from now.
I concur. All right, all in favor?
Aye.
Aye,
Aye.
unanimous. All right, very good. Next up is reviewing travel for the firefighters for firemen for Bush's services. Tanya sent a budget along. They have the money in their account. I know that Steve jumped off. There's a fire right now that they're probably on call for. So
there's 2 services they'd be going to, just so you know. Steve and Malin would be going to both of them, and then 2 firemen would be traveling in a village truck to the Albany one. And for the minute, I'm looking for his name. They are Cody Johnson and Nate Borst. So they would need approval also. There'd be no expenses except possibly meals for those 2 because it would be using our village vehicle.
So I would, entertain a motion to approve this. But we do also need to remind the firemen about they need to create that 501c4 this year because we're not going to approve a lot of things in their budget if they don't, because it's putting the village in jeopardy.
Have they acknowledged any of that since we last spoke?
Well, I think that we're going to have to sit down with the chief and the president and go over it one more time and just explain to them that they're either going to do it or we're just going to cut all, things like the installation dinners and anything like that, because it's not okay that they continue to use our tax exempt number like that. So, but I would entertain a motion to approve this travel because it is, to honor a firefighter that lost their lives.
I'll make the motion that we approve their travel.
I'll second it.
Right, Pat.
All right, all in favor?
Aye.
Aye, unanimous. Okay.
But Tanya, reinforce and pound into their skulls that we need receipts.
Yep, I've already told them and they've already agreed. Malin and Steve are bringing them all in.
Okay.
No alcohol on them.
All right. Next up is accept the resignation from Kevin from SRO.
I make a motion that we accept the resignation of Kevin Sutterheim for SRO.
All right, all in favor?
Aye.
Is he moving on to bigger and better things, or what's he doing?
Well, next up, let's just jump ahead to I. Let's approve appointing Kevin Soderheim as part-time certified police officer.
I'll make that motion.
Second.
All right, all in favor?
Aye.
All right, unanimous. There you go. Next up, accept resignation of Heather as crossing guard.
I'll make the motion.
I'll second it.
All in favor?
Aye.
All right, next up, appoint
Which
Kelly.
which one is she? Is she the one on Clinton Street?
Chief?
Yes. Yeah, she was the
And
one on
so-
Clinton Street.
And now we need a motion to appoint Kelly Randolph as a crossing guard sub.
I'll make the motion.
Second.
All in favor?
Aye.
Aye.
Okay, let's see here. So that stuff. Next up, we did that. Discuss adding a suite number to the mailing address. This must be a Tanya and Dan.
No, I know what this
It
is.
is not from me. The post office won't separate the mail anymore because they say we need suites.
Okay, fine.
And so, but the thing is, if we have suite numbers, we have to add notices to every vendor, everything.
It's a bit of a process, and I already talked.
currently,
I
all the
talked
mail
to.
in the
Jesus Christ.
building.
I've
is
already talked to
dropped
Fred
off at
about
ours.
this. He's on board. We just work with the other, the town across the way, but it is going to be a little bit of a process to get to do this very simple thing that comes from the post office, because they're getting flack from their supervisors that, when you come to 31 North Main, you can't do any special service by sorting, or you have to get out within 3 seconds, or some cockamamie system that they have going on. So, but this was his recommendation that we move to suites, and then they could spend more time, they could separate, and all that good stuff. So I think we need to look into this process to make sure that we do it properly and we're notified, and it's going to take a bit, but it's got to go in front of the town board too. So won't be till next month anyway, but it's a process we'll start working on.
Sounds like you got to do it, so I'll make the motion.
I'll second it.
All right, all in favor?
Aye.
Aye.
I would say aye, and then make it contingent upon the town doing the exact same, in their meeting.
I don't think we got any choice.
Well, I think we'll be fine. I think we're good with Tim. I think we can add Tim's recommendation, add Tim to the motion. I think it's going to be okay. I think the town's going to do it. So
Even if they don't,
Be kind of silly if they didn't do it.
yeah, that's what.
Yeah, Fred said it won't be a problem, but just has to go through the motion in front of the board. That's all.
Right.
All right. All in favor? Aye, unanimous. Okay. That's it as far as I have, right?
The added item was the discussion of the ARPA funds application for the county. So there's a second. You may not have the newest one.
Oh, okay. Yeah, I don't have that one. But I was very good with the ARPA fund application. So anybody else have?
For the, Ed brought it up, just so you know, it's what we're submitting to the county, and he would just to going through it for the request from them.
Right. Go ahead, Ed.
I put a straw man out there, and I haven't heard anything back from anybody. Now, I recommend, up to you guys, because we're a board and we should all kind of come to grips with this. We can turn in multiple requests. Just because I put down $450K to buy the Casey property and fields doesn't mean that can be the only one or that's the right number. Dan is talking about, hey, let's ask for $200K for the salt shed, because we're going to have to find it either out of our own ARP funds or somehow, because it's over. We would have to find those funds for the Casey property if you decided that. I don't think we have to cut ourselves. I think we can ask for multiple things, like a ice rink. We could do blah, blah, blah. Let's put in 3 or 4. Let's not limit ourselves. Other towns and counties may ask for, they got a whole $1 million.
I don't disagree. I don't disagree at all. I don't think I saw a deadline when they needed to know when they needed these in by.
End of the month.
September 30th.
Yeah.
But
okay.
The but part is, the sooner you get it in, the sooner they can ask you to come down and present to them. And so
yeah, I would like to get the first one in.
I'm just afraid we may lose out if we don't get in sooner.
I'd like to get the one that we have done in now, and then work on some additional ones.
I still haven't seen it.
You wrote it.
Well, I've been told it's been modified.
I thought you got that email.
Seen it.
I added my 2 cents with Dan the other day, and that was me in the salt shed, because I figure we can offset some of the costs. And the county has purchased salt from us in the past, and if they want to continue purchasing salt from us in the future, it would behoove them to assist us.
I personally think that should be a second one on its own.
Yeah, I agree.
Make the economic complaint, or, hey, here's how the county makes money. So we would have to come up with that 200K in the Casey property anyhow. So let's break it up into two. I don't mind the salt shed, but I think you're hurting our opportunity to buy the Casey property and actually get a start on fields. Where are you going to come up with the extra 200K if they gave you the money?
Well, that's why we're having the discussion.
Well, that's what I'm saying. So I recommend that we do two. One is, go for the Casey property, pay for it completely, and put in the salt shed and maybe a skating rink or whatever else we want to do.
Yeah. I'm fine with that.
And I would recommend we turn it in as soon as we can get the board to kind of look at it. And that could just be emails. We don't have to do it at a board review.
I'm in favor of that as well.
But I would recommend we all saw it at least before it went in.
Dan will email it out to everybody, and everyone can take a look, and then we'll send it in.
Does anybody have other ideas besides like salt shed and skating rink and a Casey property?
Possibly somebody to shore up and stabilize the little white church.
Ooh, there you go.
Wouldn't be a bad thing.
No.
And that ties in with Center for the Arts, and that ties in with economic development for the entire county. So
yeah, I like it. Is that something Pat's going to do maybe?
Thanks, Ed. Not like I have enough other things going on, but thank you. Yes, I will. Yes, I will do that, because Little White Church is one of my projects.
all right.
And Dan will do the salt shed?
Well, we've already, well, never mind. We'll talk.
Well, don't hurt.
Yeah, we'll do.
Okay. All right. Are we good on this? Yes. All right. What else? Do we have anything else?
How about the DRI? How'd that come out? You guys, took it away from me. So how did it look? How did you do?
Did you not look at it?
I saw something that came in about 10 minutes before the board meeting. So yeah, no.
I think it came out really good. I don't know if anyone else looked at it.
I did get an email that said we have Downton down instead of downtown on the header pages. So it says Downton.
Yeah, that's on page 11. I haven't had a chance to review the whole thing because I was doing some other things prior to our meeting, reading on Neil Exchange stuff.
Did that
But
go in already?
Say again?
Did it go in?
No. That was one of the questions I asked earlier today. Is this being electronically sent in, or is this being mailed in? And according to Keystone, they say it gets mailed in. So they told Dan and I that it gets mailed in.
Well, that's different.
That's why.
Emailed in. Yep.
So I haven't had a chance, but I've already covered a couple issues. So that'll be I only got up to page 12 prior to our meeting. And Ed, thank you for catching the downtown, because I missed that one. But
does it have a lot of transformational kind of word in it? This is transformational.
Ed, I'm only up to page 11.
Okay. I'm just saying that's what the feedback I got 2 years ago has to be transformational. So
well, I know I used it in my letter of support for it. So
well, that helps. Good.
I think if they look at the overview of where we're projecting the project, that it is nothing less than transformational.
And it checks so many of the boxes. It checks so many of their boxes. So
I do have a question. During the information, we had talked about extending the border up to Water Street.
Right.
And I don't think that is reflected.
Yeah.
In this
that may not be reflected, but it is in the application, but it's understood. How's that?
Okay.
Sort of like when Cortland applied, they applied and having a hotel, as one of their things, but they had no one that was going to build it.
Yeah.
So there are things that need to be changed, but it's understood that it extends up to Water Street and that's critical.
Okay.
Did we get any developers to sign up?
We did.
Yes.
We got Yeaman and we got Dan McNeil.
Which is the other thing is I think that they have the incorrect McNeil Corporation on there. They need to double check that.
It should be was it DM3?
Should be DM3, and instead they actually have, I think, his brother's corporation on there.
Okay.
Yeah, they have McNeil Development Company, and
That
that's
can be fixed in our presentation, because you might as well, prepare for a presentation live up in Syracuse sometime in the next 3 or 4 weeks.
we'll do that too. But we want to, if we have a known error, we need to correct that now, because we also don't want to create any rifts between the McNeil family.
No, we could send
by signing one up for something.
Yeah.
We don't need to do that.
And Fran was very
oh yes, he was adamant
that we get the right one, and I told him we will get the right one. And
yep.
Yeah, I don't want him mad at me.
All right. So we'll just let the Johns know that we have a few edits before they send it in. But being that they can email it anytime tomorrow. So we're good there.
Start early.
Oh yeah. All right. What else? Anything else on the agenda?
Victor, you didn't want to say anything? We put him to sleep.
Victor hung in there till the end. I appreciate that.
Hi, Victor's here.
What do you think? What did you think of the application, Victor?
Went back and forth. So I think it was better than I expected, but the word Downton is wrong on every single page. We're not Downton Abbey, we're Downtown Homer. That really stands
rebranding.
out.
We're rebranding.
But so it was clear, it was direct, it was equivalent to other applications in the past. It unfortunately was not transformational in any way. Just blah, put to sleep text. That is all necessary. It needs to go to the pizzazz level. I think it's fine to submit this year. It's too late. I wouldn't change anything. In the presentation, you're going to have to add the pizzazz.
Well, that's why we're bringing you.
Okay, that'll be fine.
Yes.
I can get on. I found in the directions it has to be electronically emailed, and I have exactly where.
Yeah, they have to email it tomorrow.
They just said we're mailing it. That was what Dan was saying, or somebody was saying that Keystone said they have to mail it.
No, they have to email.
No, they said it. No, they're going to email it.
Okay, they're going to email it.
Oh,
All right.
okay.
Yeah.
My hearing's going too.
Okay.
And
Anything
send
else?
them an email, make sure they do that. I think that's a good thing maybe to follow up on first thing in the morning. Or
I don't know if they listened to me very well, Ed, but I will certainly try.
Well, we need to give them our edits too.
Yeah, the edits I'm gonna inform them that edits are forthcoming, and they should definitely do a spell check or anything else.
Maybe a Grammarly.
Yeah.
Maybe more Grammarly. Yes.
All right. Anything else? All right. Comments by board members.
I just have
Ed.
something for executive.
Okay. Ed, what do you got? Anything?
No.
Nothing. Tim?
I'm good.
Kevin?
Just wanted to thank everyone that spoke tonight in regards to the needle exchange program.
Very good. And Pat, just something in executive?
Yeah.
Okay. I have I don't think I have anything either. So Dante, do you have anything?
Nope.
All right. Anybody else have anything before we go to executive? Once, twice, thrice. Questions from the media? I see none.